All right.
Okay, beautiful. So, good morning, everybody again, and thank you for joining us for another session. To our cohort members and the people who are joining us for the first time today, welcome. This is Digital Health Skills for Africa, where we improve the capacity of healthcare workers with digital skills to drive innovation as well as improve patient outcomes. Um, yeah, and also, of course, work along with the digital health transformation that is rolling through Africa at the moment. So today we're going to have a session on change management and leadership transformation that's going to be led by Rukevwe Agbro. And I'm going to hand over to her now to introduce herself. Or Rukevwe, if you want me to read your bio, I can. Or if you want to introduce yourself, you can also do it that way. And we can hit the ground running because we have a packed 3 hours. So over to you, Rukevwe.
Okay. Yes, I think you can read the bio, Ezinne, so that I can just start the training immediately. Thank you.
Awesome. So Rukevwe is a skilled meter speaker, Rukevwe Agbro, a project manager, leader, trainer, speaker, and AI advocate. She is a skilled professional with years of experience in IT project management and a certified Prince 2 Agile practitioner. Based in the UK, she has an outstanding ability to deliver projects on time and within budget, alongside a proven record in stakeholder management, problem solving, and implementing innovative solutions. As a passionate trainer, mentor, and coach, Rukevwe has trained and guided over 2,000 individuals transitioning into the IT sector, equipping them with the skills and confidence to succeed. An avid AI enthusiast, she is committed to helping others leverage technology to unlock their potential and achieve their goals. With her dedication to leadership and mentorship, Rukevwe is a dynamic speaker who inspires transformative growth and empowers individuals and organizations to thrive in today's competitive landscape. So everybody, let's give it in the chats your reactions for Rukevwe Agbro, and she takes us through this beautiful topic of change management and digital transformation leadership. So please let's see your reactions, your welcomes in the chat, or the reaction buttons that we have here. I'm not seeing anything, people. Today we need to...
Thank you so much, Tommy.
We need to be our usual self, people.
Thank you. Thank you. Maybe I should put on the video so that you can see my pretty face then.
That's the person you're talking to.
Okay. Can you see me? I can't even see myself.
Yes, you can
Right.
see you.
Fantastic. Fantastic. Okay. Good, good. Thank you so much, Ezinne. Thank you, Rudy. I can see Rudy's chats. Thank you, thank you, thank you. And I would want to welcome you as well to this particular session where we'll be gliding through the change management process and how you as a healthcare professional can, imbibe change in your environment. Let me have a look at the chat again. Somebody said, I'm so beautiful. I know, Melissa, I know. Thank you. Thank you so much. Thank you, Sunday. Thank you so much. I would like to see more comments so that I can understand my audience. Let's see who else is here. I've seen Melissa, I've seen Sunday, Rudy, Tommy, Tuwilika. I've seen who again? Yeah, Tuwilika, I've seen you. I think I saw you on LinkedIn as well. Thank you, thank you. I'm super excited as well to be here. Yeah, Camila, thank you so much. Thank you, thank you. All right, I think I'm satisfied with the comments. So let's go on with thank you, Perret, for that. I feel at home because I'm African as well. I'm originally from Nigeria, but I live in the UK. So I feel at home talking to Africans and how we can together, change the world in the healthcare sector using digital transformation. All right, so before I start again, let me understand my audience, where you are and what your role is. Are you a doctor? Are you a nurse? Are you staying at home for now? And let me know who you are so that we can, sort of bond well. So let's hear from you. At least I've been giving you a fantastic introduction, and I would like to know you as well. What's your role, your location? Let's go. I would like to know your role and location, please.
Guys, let's not be shy.
We have Parrots. Parrot, what's your role? What do you do? Melissa, Rudy, Sunday. Let's go. The session is the chat space is quiet.
I don't know. This is all like my people. They always.
Is it a pretty face? Should I turn it off? Is it too much? Oh, thank you so much. Thank you so much, Mezika. Mezika is a medical doctor, a lecturer, and clinical governance and quality coordinator at Dila University, Ethiopia. So when I'm going to Ethiopia, I would reach out to Mezika so that I can see her. Camila is a pharmacist from Nigeria. Fantastic. Let's hear more. Let's hear more. And this is like a networking session as well. You never know where you meet people or how people can help you to improve your career growth. So let's open up. Tell us about yourself. Be confident. Even if you are a stay-at-home person, it doesn't matter. It's just for us to sort of continue to network so that I can remember people, as we move on in all our careers. Okay, Tommy is a pharmacist. He's a data analyst and he's a project manager. Yes, 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 yes. My co-project manager. Okay, Mbe, apologies if I'm not pronouncing your name well, is a nurse from Kenya. Fantastic. I stayed in Kenya for a year and it was awesome in Nairobi. It was really, really nice. And I hope to visit there very soon. Melissa is based in Lagos. She's a state coordinator from an NGO. Now I know who to reach out to when I need some help. And she has been in the tech industry on the tech journey. She's currently working as a product manager in a health tech organization remotely. Lucky you, and a wife, mother, juggling. I know. Tell me about it. I know. Sunday is a public health professional diplomat based in Gaborone, Botswana. Fantastic. How is Botswana? I always wonder how Botswana is. I've never visited there, but I would love to. Thank you so much, Sunday. So if you can keep sharing while I start, that would be more appreciated so that we can continue to bond as we go along. Okay, now the good stuff, change management and digital transformation. Why are we here today? The aim of this session is to unlock the future of healthcare in Africa through strategic change management. This training will guide you through critical processes of digital transformation in healthcare sector, right? Things are changing really fast. The IT space, I am an IT project manager, and I can tell you that things are moving really fast. We are all trying to catch up with the trends of IT, especially in the AI sector, right? And it's very, very crucial for us as Africans and in the people that are representative of Africans in the healthcare sector to be able to produce and provide and implement change to your organization. Let me have a look at the chat again. I've seen some popped up. Rudy. Oh, let me go to Parrot. He's connecting from Jos. I visited Jos in Nigeria. Jos is a very fantastic place. You're a medical doctor, working as a director, health planning, research, statistics, very interesting. With the state government transitioning to digital health, fantastic. Come. There's a lot of space here. Rudy is a medical doctor from Cameroon, science communication expert, developing digital learning technologies with Yale Digital Health Lab. Invited to the PCST. Fantastic. I'm so excited that Africans all over the world are changing, the world. Tubilika is from Namibia, a medical doctor from medical internship, also serve as a board member of Patient Care, a telehealth company in Namibia. He's a change, I don't know if it's a, apologies, it's a lady or a man, a change maker and a SRHR advocate through Tuba Bloom. Fantastic. This is awesome, and this is why we are here. Tuwilika, I feel like we should just unmute and you just take over the training space, because you're already, implementing changes where you are. Wende is a pharmacist, data analyst, AI engineer based in Nairobi, Kenya. Fantastic. I'm so excited. Dolapo is a medical doctor from Nigeria, also working as a product designer with Fortitude. Oh, interesting, interesting. Transitioning into the digital health. Fantastic. Very, very interesting. I have understood my audience. I know what and where we are now and how I'm going to challenge you as we move on with this training. All right. So as I was saying, change management is really important for all of us, especially as Africans, to sort of understand where we are now and where we would like to take wherever organization we're working for, where we would like to take them to, right? Be that change maker in an organization. Even if you do not have all the resources needed, the ability for you to have that knowledge and impact it would really, really make positive impact in Africa. All right, let's go to the next slide. Why digital transformation in healthcare? The question is, why not? There are so many opportunities in Africa and how we can imbibe digital transformation in our daily activities. But what is digital transformation, if I may ask? Is the integration of technology to enhance patients' care, improve workflows, and modernize healthcare services. It is not you taking out everything that has existed. It is leveraging technology to make things that are already existing better. A very simple example of digital transformation is Uber, right? When you use the Uber app you're not eliminating the car, you're not eliminating any vehicle, but you're using the app to leverage on or to reduce the stress of going out there to look for a vehicle. Sometimes I found that it could even be cheaper based on the distance or based on where you are. And that is digital transformation, right? The vehicles are still there. But what you have done is to reduce the cost of, of stressing yourself to go and look for taxis or go into a bus or get stained or get spat at or have just, have a very smooth journey from your home to your destination. Okay, so Uber is a very good example of digital transformation. Why does it matter? It can help to increase access to quality health care services, as some of you already know, and I can see that in some of your comments. It can help to improve efficiencies and reduce costs, of course, because all organizations, I've not seen any organization that does not focus on reducing costs, right? If you are that person that is always thinking about how to reduce costs in your organization and improve their ROI, which is their return on investment, you're going to be a very strategic leader in your organization. I always call myself a solution finder, right? Even in the place I work, because I'm a global IT project manager. Even in the place I work, I always try to see things that can be better. It could be in documentation. It could be in just automating my tasks to make sure that some things that I do over and over again are automated, just to reduce that cost of overthinking of things and automating them, especially things that are done, every day, right? So as we are speaking and as I'm talking about digital transformation, while some of you are already doing that, it will be good for you to start thinking about ways in your organization how you can enforce and imbibe change within where you are, right? There are many ways, there are many things to do. And thankfully, because I said I'm an AI advocate, thankfully, AI is making things a lot better, right? So as we are talking about digital transformation, as we're going into the change management training section, let's start to think of in your hospital, for example, in your organization, in the pharmacy you work with, what are those things that you can make better? as an individual, right? How do you start? Who do you need to reach out to? Okay, so that is why digital transformation matters, because it can help to improve efficiency and reduce cost. It can also help to foster better collaboration between healthcare professionals, and I'll be telling you why as we go on. Cautious of my time, so I will be checking the time to manage my time well. Now, as we all know, it's easier said than done. We would always have challenges to in the digital transformation space, right? When you're trying to move an organization from the as is, where it is, to the to be, you're going to be facing a lot of challenges. One of the major challenge the healthcare sector usually faces is data security. You've got a lot of patients, different caliber of patients, and even if they don't have any status quo, you need to protect their privacy. You need to protect what is being shared with you, and that is why is one of the identified challenges that is being faced if you want to start implement digital transformation in your space, right? Another thing is legacy systems, integrating new technology with existing infrastructure and workflows. Imagine using a very good example. Most hospitals don't do that, but some remote hospitals or local hospitals are still, using papers, using folders, right, to get information from the patients and store them in folders and papers. Now, imagine you want to provide a solution where you no longer use folders or papers, right? And then you have an old person that has been visiting your hospital since 1978. Where do you want to start from with getting those very old, long-standing folders and integrating it into, for example, the system? So this is one of the challenges of digital transformation, right? The legacy systems, how to integrate it and make it more efficient for people. And then the one we're going to be really focusing on today is the resistance to change. There will always be resistance to change. Addressing concerns about new systems and workflows. Another thing is the complex ecosystem. As we have seen today, amongst you all, some people are pharmacists, some are doctors, some are researchers. How do we, and there is a web, right, connecting all of us. There are some people that supply medicines to the organizations. These people, all of them are called stakeholders. How do we integrate all of these people to profess or provide change within the healthcare sector? This is why we say that the system, the ecosystem is very complex. Navigating this web, trying to reach out to people, nurses, clinicians, and administrators, bringing them together to implement change. This is another challenge of digital transformation in the healthcare sector. All right. I'm going to be using a scenario, which you may all know, just to buttress how we can implement change within the healthcare sector. The scenario here is telemedicine. We all know what telemedicine is, but for the sake of people that may not know, it is it's a platform that is used to do virtual consultations and manage patients' record. And what has been the goal of telemedicine is already existing, is to improve access to care and reduce administrative burden. And how does it work? Patients can request a virtual visit with a healthcare provider. The healthcare provider may send patients information of forms to fill out online. The healthcare provider may check that the patient has the necessary technology and software, and the patient can join the virtual visit using a video chat. What does this mean? I don't have to go to the hospital, right? You have an organization or a hospital, have all my information. All I need to do is to put on my laptop and gain consultation from the doctor. How fantastic is that in telemedicine, where you're not thinking of how to, and you can even reach out to any doctor across the world as far as you register in their platform, and they can tell you what to do. administer medicine to you and say, look, you have this issue based on what you have told me, and this is what I would refer you to. Or they could also refer you to other organizations just with a video. When we were growing up, telemedicine was not available, so we had to go to the hospital, stay in long queues, go to the pharmacist, stay in long queues, and you're even more ill. You're even more ill before. You're going with a headache and you're coming back with body pains, right? So imagine what telemedicine has done across the world. This is why I want to encourage you, whatever you are doing now, especially as Africans, be bold enough to research and provide strategic changes within the African healthcare sector. Be that person that people look up to provide solution. I always call myself a solution provider. Wherever I am, I'm providing solution, no matter the resistance, no matter the changes. So I want to continue to encourage you as I go on to say, what are those things in my organization that I can change? Something as little as, for example, changing a chair, just something little. It could start from there, and your influence starts to grow as people begin to trust you. Okay. All right. So this is a scenario for telemedicine, and if we continue with telemedicine, most of the benefits where telemedicine can be more convenient than visiting a doctor's office. As I said, it can be easier to fit into a busy schedule, and it's even more relaxing for the doctor, right? Doctor, it can schedule themselves to consult people at their own time. It can improve access to healthcare services in rural areas. So imagine a doctor, right, going with a lot of his staff, for example, to a rural area. However, if he can just send one staff to go to a rural area, they put on a video and gain that consultation, the staff or the nurse would know what to do immediately, right? And this is the power of digital transformation. Okay, so not that the doctor will not be available, but he or she will be available in a different way. All right. But what are the challenges faced? The first thing here you can see is resistance to change. As much as it's, like I said, it's easier said than done, many people resist change. People just like their comfort zone. People don't like change. People just want to continue with what they know. A lot of people are very scared of moving on to the next step because because of the fear of the unknown. Okay, unclear roles in implementation, lack of training and confidence in using the system. This is one very challenges that usually faced with people, especially people that have sort of not everyone that have crossed the 50, 60 years age. They start to think, look, all of these things were working for me before. I don't necessarily need to change anything. It's working for me, right? But it may not be efficient enough for you to be able to even address other concerns within the organization. So this particular scenario is highlighting the benefits of digital transformation and the challenges that are being faced. Just three main challenges that are being faced in the telemedicine scenario. Now, let's go to the good stuff. Change management. I've been talking about change, how you can do this, how you can do that, and how you can, build an airplane and fly to another country. But what is change management? It's a structured process. The word there is structured. Please pay attention to structured, because it's one thing to want to implement change, is another thing to not be able to provide a structured process to it. It's a structured process that helps people adapt to organizational changes. It involves preparing people for change, implementing it, and then helping people use the new process. That's a lot of work. But can you do it? 100%. Have I done it? Yes. Let me have a look at the chats. Hey, Charlotte. Okay, Charlotte said, in our local context in Cameroon, I think internet connectivity could be a major challenge. Okay, so you've identified a problem, and we may be using your scenario as well, Charlotte. You've identified a problem, internet connectivity. But try to start to think about, okay, how did other rural areas, your local context, how were they able to um, how were they able to provide solution based on this problem, internet connectivity? Was there a place that they would go to connect, connect to people, gather everyone, and solve problems quickly? Or was there some form of device that can be used there? These are some of the things, and I like that you're thinking already of, okay, we're having this problem. You've identified a problem. We're having this problem. What can I do? As far as you have identified the problem, there is a solution somewhere. So there could be devices that you could use, right, that could, improve the internet connectivity, or you could use that particular device to consult with people, right? But let's keep going on. And I like your thought process. Please continue to share your thought process so that we can sort of just discuss it. And we all have other people here who can also help Charlotte to bring, to prefer solutions or ideas as to the internet connectivity. All right. So as I was saying, the first thing here is structured process. The next thing is to help people to adapt to it. The other thing is to prepare them. You have to prepare people's mind, especially if you're not if I mean, there are lots of people that love changes. I love to change things. I do not like things staying the same. My body starts to itch me when I do something over and over and over again. I love the challenge. However, some people, they're not just interested, they're just like, look, take it easy. I don't want all of that. So you have to prepare people for change. You have to also implement that change in a structured way. And then, because if you do not implement changes in a structured way, it could sound like a good idea, but it might fail, right? Many people have tried to bring innovation, bring a lot of things without the mindset of providing a structure for it. Because when you provide a structure for it, this is where scalability comes in, where you provide something, it has a process, it has a structure, you can use it in other places as well. Okay? So this is why in providing a structured process when you're doing your change management is very crucial. And I'll be sharing with you in the upcoming sessions, slides, how we can implement change using a framework, okay? So once you are able to use that framework, especially when it comes to people adapting to that change, you would be able to provide a structured process for scalability, okay? Let me have a look at the chart. You're most welcome. All right, let's go to the next slide. So I think we now have an understanding of what change management is. Like I said, it's one thing to call change, is another thing to provide a structured process for it. Now, why is this change management important in the healthcare sector? It can help with improved patient care. It can help with regulatory compliance, and it can help with operational efficiency. Now, you as a healthcare professional, you don't want to be frustrated, because once your patients are frustrated, you are automatically frustrated, right? Change management can help can help the effective use of digital tools to enhance your patients' care, right? So that your patients are well relaxed, you are well relaxed, everybody goes home to a fantastic, and to have this how do I put it now? To have this mindset that things are actually working. Okay. I remember when I was in Lagos, Nigeria, and previously there's this hospital that we used for the kids, and they were still using papers and folders, right? A very good hospital, but everybody, good technical, good knowledge, good experienced doctors and all. but they were still using papers. So anytime we go to that hospital, we're just like, brace yourself, 4 to 5 hours, brace yourself. You're not going anywhere. Just call the day off, that call your bosses that you can't come to work because you need to go to the hospital. Because we're still using papers, folders, they would call you, who is next, and all of that. But guess what? In the next 5, because it was a lot. Good doctors, experienced doctors, but people were, the patients kept increasing based on recommendations. So anytime we go there, parents are already frustrated, kids are crying all over the place. It was a mess. It was always a mess. Although, yeah, your kids will be better based on experience from the doctors, but it was always a mess, right? That is why I'm talking about how improved patient care, it's very important when you are providing change management in the digital transformation space. So in the next 3 to 4 months, when one of my child took ill, we went back to the hospital and we started to notice the first thing that happened was we got into the hospital, the administrative place, and everywhere was a bit empty. It was unlike them. And I'm like, what is going on? Are the doctors on strike or what is happening? But we started to see a difference. When we got to the admin space, everybody was using a computer. They were typing in things. This was years ago, actually. They were typing in things. The process changed automatically. Everything became digital, right? Even the nurses and the doctor did not have to call you. Just hear a bell and a number would, they'll call a room number and your name, and then you come in. Nobody needed to come out and say, Rukevwe, come out, you're next, right? Everything was organized in that way. What happened? They moved from using all of these folders to, of course, registering the patient's names in a system, and we're going to be talking about that soon, in a system that helps to reduce the time of administrative work and providing efficiency for both the admin, both the doctors and the patients. And everybody became, we felt better. In the next 30, 45 minutes, we're out of the hospital. That is what change can do if you are bold enough to take that step. It was really a fantastic experience. I was really shocked about it, and it just made a lot of sense. They just ask your name, you type it in, and that's it. They already know your history. They don't need to ask you questions all over and all over again. They tell you to go to check yourself and do the way and all of those things, right? So it improved the patient's care. We were not going to, I wasn't going to call off from work to say, I'm not going to work today because I had to take my child to the hospital. Okay. The next thing here is regulatory compliance. Proper implementation of digital solutions maintains critical healthcare regulations. Sticking to the compliance and the policies is very, very important. Why? When you're introducing change management and how change management can help in the healthcare sector. Operational efficiency. The admins at that time, the receptionists in that hospital I was referring to, became more relaxed. Their faces were not all straight. They became more relaxed. Everybody was happy. Everything was moving well. The process was working, right? So it helped with operational efficiency. Everybody became more efficient in their work. They could administer even more patients, right, without feeling burnout. All right. So that is one very good way change management matters in the healthcare sector. All right. So what is this process I have been talking about since, right? What is this process in change management that you can implement wherever you are? Now, maybe we should use Charlotte's example instead of my own telemedicine, since they raised a very key problem. Now, let's start. Some of the steps of change management, the first thing is identify the need for change. Please respond. According to Charlotte's problem, what do you think is a problem here? Can you type it in, apart from Charlotte though? What is the problem that they have mentioned? What is that problem? Hello, hello, hello. What is the problem? So the first thing here is to identify the need for change. Identify the problem. What is the problem? Thank you, Tommy. Poor internet connection. Thank you, Mexica. Lack of internet connectivity. That is the problem. Simply put, the problem is lack of internet, right? Now, we've identified the problem. The next thing would be to develop a change management approach to the plan, to a change management plan. You're not necessarily providing the solution. It's saying, how would I be able to provide change? And the next step here is to identify stakeholders. Who are stakeholders? Anybody that can influence the decision around you. It could be your boss. It's always the patient most of the time, especially in the healthcare space. Anybody that is being affected by the situation, or anybody that is being influenced by, that can influence the situation, right? So in your thought process, who do you think are the key stakeholders in Charlotte's case, this problem we have just identified? Who do you think? And Charlotte, you might help us with this one as well. Who are the people being affected, right? And who are the people that may be able to influence and help these people? Thank you, Rudy. Who are the stakeholders? Like I said, a stakeholder is someone that can be affected or can influence the situation. Thank you, Melissa. Fantastic. The patients, the national telecom, and the government. Fantastic. Yes, that's it. Those are the people. Thank you, Charlotte. Thank you, Ibinabo. Patients are the most affected. The hospital management can influence the situation. Fantastic. Charlotte says the patients and the network providers. Now you have seen that you've identified people you may be able to reach out to that can influence the decision. Why are the telecom providers? Why is it that we cannot get internet in this place? Those are the people you start to list out to say, this, we have a problem. Can you tell me why these people are not able to get connectivity? Why is it that other people have that exposure to internet, and these particular people who need it probably the most are not gaining that internet connectivity, right? The another thing, another stakeholder that you just mentioned are the patients. You may be asking, what can the patients do? They are the people that are getting hit. So they are the people that you would want to listen to so that you can provide help for them, right? You have to know, okay, what is the distance between your house and this hospital? Or where do you live? How does this affect you? You want to understand their situation so that you can reach out to these telecom people. You can reach out to the hospital management to tell them the specific problem of the patients. The patient might say, oh, I do not have a car to drive all the way from this to that. Or, oh, I'm not able to even call my doctor when I need them because of this internet thing. So you need to understand the patients, their problems, who are the key stakeholders as well, because you can't just provide your own problem as a change maker, right? You need to understand and document their problem, do some interview, and ensure that whoever you are going to propose this thing to sees your perspective, sees their perspective on how to implement change. So now we've identified the stakeholders. I think we've already covered communicating the changes. Now you have gotten a list of, you've gotten the problem, you've gotten the stakeholders, you've listed your patient's problem. Now you need to communicate the change. And when you're communicating the change, you also need to ensure that you have preferred solution based on your interactions with all of these stakeholders. You've met with them, you've said, oh, yeah, we've had this problem, and they said, oh, okay, we think we know the problem. You are documenting everything, and you are probably connecting with everybody to ensure that you are preferring solution for each for this particular situation, right? It could be that, okay, the telecommunication providers may have a device. I'll give an example of my house here. When I used to have internet connectivity, especially in this office. Everywhere around the house has internet. But when I come to this office, it's just like, what's the problem? It keeps going off and all of that, right? So I reached out to to these telecommunication people, right, and gave them my situation. Can you see what is going on? What is going on is that I have communicated. I'm communicating. I have told them I have raised a problem. I've met the right people who are the stakeholders. And then they say, oh, okay, it could be that they explained something to me that I did not document because I'm not the one implementing the change. And they provided a solution for me. They gave me a booster, right? They said, just put this booster in your office. It would start to attract, all of where the internet is. They knew better. This is why you also need to ensure that you are requesting solution from professionals, not just yourself, not just your research, by communicating with the right people. Sometimes it could be that even the telecommunication people in Charlotte's situation may not provide 100% all the solution, right? It could be something else. It could be another company that is really triggering this internet connectivity. So they provided me with something I never thought about before, right? Just plug in this booster in your office and you're good to go. So what am I saying in Charlotte's case? They may provide a device to say, okay, in this particular office, why don't you use this device, right? This device can attract more internet connectivity and you're good to go, depending on a more broader perspective of Charlotte's case. Now, let's say, for example, Charlotte has brought in, I'm just using an example, the device, right? To say this device will provide a better internet and connectivity, right? We're going to mount it here so that patients are able to, consult if it's telemedicine they're trying to introduce and all of that. So they've mounted this device, right? And nobody knows how to use the device. That's where we go to in the next step here, which is providing training and support. They don't know how to use the device. It's just, okay, the device has come. Charlotte is the person who raised this issue, who is a change champion, and who is ensuring that everybody is being satisfied. But nobody knows how to use the device. They don't know what is going on. Solution has come, but yeah, nobody can implement it. This is where Charlotte will come in to provide training and support. And guess what? It's not only the patients that needs training. The hospital, or if Charlotte is referring to a hospital, the hospital management as well, they all need to be trained to be able to use this device. Just like the booster I told you about in my office. Yeah, it was so easy, and because of all the manual, I just plugged it and put it on, right? But sometimes it may not be like that. It could be that you need to press this, press that, do this, do that. So Charlotte, who is a change champion, will then provide a guide for everyone to be able to use. This is where process comes in. So that if Charlotte is not there, right, any other person that is in the hospital can provide that guide to any other person that is coming in as a patient, right? Or any other new office worker coming in, right? But he or she has provided a system that can help to provide, to improve this change. That is why, like I said, it's one thing to just talk about change. How do I make change? It's another thing to develop structure to it for scalability's sake, especially in Africa, right? If it has worked for Charlotte and her team, Charlotte should be able to move it to another country as Africans. Charlotte should be able to move it to other local places to say, oh, this is the process I structured. We had this problem as well. I met with these telecommunication people. I met with the hospital management for, of course, approvals, because there may be cost attached to it as well. I met with them. I did this. Here is the document. Have a look at it, and let's implement the solution here. That's how we grow as Africans, right? Not gatekeeping, please. We don't gatekeep here. Okay? So Charlotte would also say, after we had found the solution, which is including a device that would help to, increase the internet connectivity, I also developed a process, a guide to be able to, for this hospital, for the hospital workers and for the patients to be able to use this device effectively. Let me have a look at the chats. This change management process is very insightful. Thank you so much, Tuwilika, and straightforward to use, no shortcuts, exactly. Once you have a process, once you have a framework, you can do whatever you want to do with it. All right, so Charlotte has provided this training and support, right? Now, here comes resistance. There are many people that will resist Charlotte's work. Sometimes it could be for personal gain, as we know, in Africa. Sometimes it could just be that people just don't like change. And we're going to be talking about it very soon, and you would see some of the resistance and the barriers. And then, of course, if Charlotte has been successful to imbibe this, to go against this resistance, Charlotte will be able to implement this change. And then, of course, we have to evaluate it. You have to keep checking for your sustenance and purpose. You have to check that everything is going well. How do we sustain this device? How do we take care of this device? If we have 50 patients coming in, how can we manage the internet connectivity? What if they increase, and all of those good stuff? Fantastic. Yes, Melissa, cultural norms, that one is the strongest. When culture comes into a place, and you just need a lot of how do I put it now, help to be able to break that resistance. So this, in summary, is the change management process that you can use in your organization that would help to streamline this. It's simple. The process is easy to follow. However, the changes you are making could be very, very difficult. Okay. All right. So let me check my time. All right. So let's move on to the next one here, which takes us to let me this thing, it seems. The barriers and resistance to change. Okay. Let me have a look at the chats, because I want to also ensure that we are all going. In reality, it's very tricky and tedious to succeed. But is it doable? Yes. Can it take years to accomplish? 100%. Can it take months to accomplish? Yes. What's that? That's what's most important. Now, people resist changes in different ways. And we're going to be having a look at each of them based on Charlotte's scenario. Fear. Now, Charlotte is trying to, provide this change to people. They see the communication organization coming in with a very big device to come and dig into the ground. Everybody becomes scared. The patients that you want to help will be like, look, don't come and destroy our life with this thing you are bringing in. They don't know yet the benefits of improving this internet connectivity. So they're scared. It is Charlotte's process. Remember the process we talked about, the process of adapting to change, that can help to reduce this this scarcity mindset, or this fear of not, people don't want to improve their life. Some people can be angry. The fear can lead to anger, right? That is why you need to ensure you buy in your stakeholders. It's not one thing for you to come. And usually this is why you see that When all of these Western companies come to a local place, they don't go to the people directly. They go to someone that can influence the people, right? That is why if Charlotte is there, and let's say Charlotte grew up there, for example, she's the only person the people are likely to listen to. So that is why you need to be very strategic, especially when you're listing out your stakeholders. These Western people would come, they would look for maybe the what do they call these people now? These people that like the chief of the village, for example, and their kids and all of that, and pay them a heavy sum of money because they know that they can influence others around them. This is why you, as a change maker, bring yourself down to people, whoever you want to change, make changes to, because they need to see from your perspective that you want to help them and you don't want to, destroy them. All right. Let me have a look at the chats. I'm liking the conversations that are going in. Yes, Charlotte. Stakeholders buy-in is very important. Community leaders, religious leaders, exactly. Somebody wants to come into a mosque or a church. Who do you think they'll get to first? Let's say they want to change the building, or they want to move the building and destroy the building. They won't come to you as a person who attends the church or the mosque. They'll come to the pastor or whoever represents to influence that person. And that is what you need to do as well when you're making a change. You need to ensure that you're looking for the person that can influence these people, and positively, of course, not negatively. All right. Now, the next one here is habits. Habits are very difficult to, to do away with. You need to ensure that everything you are doing is for the advantage of the people. They have the habit of, I read a story where there's this person that wanted to preach, so to say, to some particular type of people. But what he was going to say was, I'm just using an example, please. He was going to use, is it bread and butter now or something? Well, people don't eat bread and butter. Let me give an example. They were eating something like meat. So he had to replace that bread and butter in his training to meat, so that they can understand. So you need to ensure that you know your patients, you know the people or the hospital management, you know how they would respond to things based on their habits. You need to be strategic. Let me tell you, once you're able to influence change in any place, especially in the health sector, it will give you a lot of confidence that you can do any other thing. Once you're able to influence people to do, to make things better for them, once that thing has come to fusion, you'll be so proud and confident in yourself that you want to change the world. So if you are able to influence their habits, understanding their habits, right? And most of the time, it could be even in all these big organizations as well, not just a local situation we're talking about here now, right? Old habits die hard. But if you are able to influence people, make them comfortable with you, there's nothing you cannot do. And that is where stakeholder management comes in. I'll give myself as an example, right? When I'm meeting a stakeholder, it's always about them, not about me. I try to remove myself from the situation. The only thing is my mouth I'm using and my body movements. I try to influence them in the way that, look, I'm doing it for you. I want you to succeed. And they see it in you that you actually want to make something better for them. And they start to trust you. Okay? Let me have a look before we move on. What happens if the stakeholder are really, you need to speak their language. Thank you, Tommy. What happens if some of the stakeholder are really resistant, maybe due to the fact that they might, why is this thing covering it? They might lose something if they change. Yes, we're going to be talking about that. Yes. That's a very good question. All right. So habits, negative thinking. You're bringing a device to a local place, and they're like, this device is going to destroy all our our company, is going to destroy everything, it's going to kill all the fishes in the water and all of that. Another thing is the attitude. Another thing, like someone mentioned, is the culture. And how do you influence culture? Look for the person who influences this culture. Understand with them. You have to sit with them to understand how they think, how they relate, their language, right? Because if they see that you are not interested in them and you just want to throw things at them, you would get a lot of resistance. Subjectivity, the people, the emotions, and then poor planning. If you are a change champion, like I always say, you need to ensure that you reduce the fear of poor planning, right? You can't do this on your own, right? Especially if you are in you're trying to influence a local team. You have to guard yourself with your colleagues, right? To say, hey, I'm making these changes. I can see you're a project manager. Can you help me plan this change? At the end of the day, this is what you would get. Sometimes some people just, you'll be recognized. And then I always tell people, when you are trying to perfect change, if you do not provide this, what is in it for me, for them, you're wasting your time. So you need a strategy that would convince them that this thing would happen. Even the people that are volunteering for you, you need to convince them by you doing it yourself. You can't just tell people do this and they're just on their own. You have to carry everyone along, ensure that you are the hardest worker so that they can see that, oh, this thing has a future. Okay? All right, so these are some of the barriers and resistance to change. Let me have a look, because I like these conversations. Fantastic, Nuran, thank you. First, understand why they are resistant by actively listening and identify their perceived loss. It could be something very simple. They can just be telling you, yeah, we're going to lose. So understand it, because it could be that whatever they are saying is something you can provide at the snap of your finger, right? Communicate transparently and frequently, addressing proactively, engage resistors in the change and process where possible, and build coalition of supporters. Fantastic. Thank you, Nuran. Beautiful. All right, Nira is also saying migrate perceived losses by focusing on the gains and exploring compromises. Yeah, this is what I was talking about. Document concerns, involve leadership if needed. Let me tell you something. When I was in Nigeria then, in some years back, I was teaching, right? When I meet the parents, we are having a conversation, open day and all of those things. What I started to do was to give that parent the idea. They don't see that we care as teachers, right? Until you show them that you care for their children. So whenever they come for this open stuff, I open a book. I already know their children's problem because I'm their teacher. But I open a book and I start to write down everything that the parent is saying in front of them. Do you know what it does to them? They feel very confident that they can trust me with their kids. And that's the body movement I tell you about, right? And this is what Nuran has shared as well. Thank you, Nuran. Malisa say, for example, in implementing telehealth or other digital health solutions in rural areas, social economic status in rural areas, or cost of buying data and smart can hinder adoption and overall change. Sometimes they like the idea, but money issues. So usually when things happen like this, Malisa, start small. Let them see the first change, just small. Implement something small, because most of the time people want to just, do a lot of things at the same time. Even if it is providing a folder for people to organize their papers. You want to start removing papers, and you want people to start to use computers to document patients' issues, right? But even if it's to start small, to say, all right, let's use folders to organize ourselves. In the next 2 years, this is the plan. They will gain your buy-in, right? All right, let's move on to the next slide. Now, how do you overcome resistance to change? And these are some of the things that Nuran was sharing as well. you identify the barriers. You have to conduct surveys and focus group to understand concerns. In Charlotte's case, you have to understand the patients. Why are they having this internet connectivity? You have to go to the telecommunication and say, what is the problem? These are the ways to identify barriers, and then you communicate. If you can over-communicate and over-communicate, it would really help you. Develop targeted messages showcasing improvements to each stakeholder group. Provide support. Offer tailored training programs, dedicated support channels. In Charlotte's case, this is where I was talking about using, developing a guide. Now, Charlotte may not be able to provide that guide, but Charlotte may know someone that can provide it for free. Charlotte may come to me for example, to say, you're a trainer, you know how to organize, things like guidelines to things. Can you help me? In exchange for this, you would be able to, get other training activities, something like that, as my own, what is in it for me, right? Or you see me as a trainer or someone who likes change, you can just quickly come to me and say, look, I share the same value with you. These are the issues my people are facing. I'm someone who wants to always implement change wherever I see it. You already understand my kind of person, so you have gotten my buy-in without even paying me anything. Okay? Provide support and then recognize champions. Just like there was someone here that said he was a change champion, which is fantastic, right? So you are a change champion, but recognize others as well, so that you don't do it yourself and don't get lost. Now, let's have a look at the framework you can use to implement change. It's one thing to understand the process of change. It's another thing to use a framework. The framework we'll be talking about here is the ADKAR framework for successful digital transformation. It's a change framework you can use to get people's buy-in. We're going to be starting from number 5, which is awareness. You understand there's a need for change, right? Now so this ADKAR framework is really focusing on how people can adapt to your change. The first thing here is awareness. And ADKAR stands for awareness, design, act, reinforce, and results. Before you start a change, you need to ensure that you are creating awareness for each stakeholder. There is no internet connectivity, but we can do better. We can improve, we can implement a device that would help with this internet connectivity, right? There is no, if we do this, we would be able to get this, and we will be able to, the old lady that has been ill for years and cannot even travel to the city to get proper consultation, can be able to get this consultation if the internet connectivity is working. So you start to, blow your trumpet, so to say, to create awareness of the change you want to implement. And then, of course, you design, you plan and prepare to say, if I bring this old lady that has been ill, we can't transport her to the city, but we can use this effective way. The plan is to bring a device, get this device working. And I, as a change maker, I would bring my laptop, and then we'll consult with professionals across the world. And that old lady may be able to get help that she needs. Guess what? If that old lady has gotten help, right? You don't need to, when you want another change, you don't need to, speak too much of English. They know that you're in it for them. So the next stage here in the ADKAR framework is design, and then you act, you implement these skills, right? After implementing these skills, we have seen a lot of changes in the healthcare sector that has failed woefully. So you need to reinforce. You need to reinforce those guidelines you developed right, for them to be able to use that device for the internet connectivity, you need to continue to reinforce it. Use these guidelines. You cannot do anything without using these guidelines. Continue to use it daily. Did you tell this patient to look at the guidelines first? You have to reinforce until it becomes a habit for them. And then, of course, you have to document your results because you're a change maker and you're going somewhere else to implement another change. Okay? Or you could even be doing them in parallel to say, I'm making changes here. This is where I've gotten to, right? Maybe we are stuck on money. We are stuck on some resources. The people that are going to release resources for us maybe have told us that it will come in 6 months. So we are stuck on this, but I'm doing this as well. And guess what? You're gathering your portfolio as well. All right, so this is the ADKAR framework for successful digital transformation. Now, what are the key elements of effective change management? Like we've been mentioning, we've been talking about, is the leadership buy-in. Because you can't do it on your own. Some people have the money. Do you know that many people are looking for where to spend their money? Believe it or not. So many people are looking for where to provide value, but they also need where the people they can trust. The question here is, are you someone that can be trusted? You have this influence in your hand that you're able to make a change. Even if you're working in a pharmacy, for example, you're able to make a change, right? Would you be trusted that you can provide a documented process and also implement it and also reinforce it and continue to provide results? Because when you see that people are being granted sponsorship, granted all of this good stuff, it's because they've been trusted over the years. I'm telling you that people are looking for where to spend money. They just don't know who they can trust. So that is why you, as somebody that can make that makes changes, can also need to also do a lot of research. Money is out there. So you need leadership buy-in. Executive support drives change adoption. Regular updates maintain alignment with regular updates continue to maintain alignment with organizational goals, right? Especially when you're working in a big healthcare sector and you're implementing change in your department, no matter how little it is. Even if they do not ask you for updates, give them updates. Even if it's via emails or via monthly meetings, provide updates to these people that approved your money. Do you know what it would do? If there is anything they want to make changes again within that organization or outside the organization, you would be the person to be recommended. I've learned something in my own experience, right? Working for a global organization, that over communication, I don't feel bad in over communicating. Because when you communicate in a very strategic way, so when I say communication, you're communicating results, you're communicating what you're doing, it helps people to be relaxed. They're not saying, oh, what is this person doing with my money? Or what's this person doing? You just communicate. There's this group I joined where I support them financially, right? And I noticed something fantastic about them. Every month, they would send an email to update me on what they have used the money for. So the next time they come, how would I give them money? I would. So that is why it's important for you to be trusted and for you to ensure that you update people regularly, whether they like it or not. Because guess what? People are busy, people have short attention span, but when opportunity comes, you will be the first person they think of. Let me have a look. Yes, Melissa, thank you. I want to thank you all for your communications in the chats. Makes me really happy that I'm speaking to effective change makers. So Melissa said effective communication gives a feeling of transparency and foster trust. We sell feelings, right? The brand you wear most of the time, it's not because you probably like them. It's a feeling they sold to you, right? Instagram is a feeling of relaxation. Let me just relax and laugh and look at my reels. It's not because I don't understand how the it works, the platform works. But what I know is that it makes me relax. You know, it just makes me laugh. I see what is happening around the world. Just give me that feeling of relaxation. So you sell feelings to people. Another thing here is training and development, empowering teams with skills and knowledge. Like I said, as a change maker, you should be able to have the expertise of what you've done, and then also ensure that people are trained, right, to follow up with this new knowledge. Culture shifts, fostering a digital first mindset across organizations. So what does this mean? It means that whenever you are providing change, right? And of course, it's in a digital transformation change we're talking about here. Whenever you're doing that, start to build seeds in their mind that whatever we are changing, we would leverage our digitalizations. That means we would use digital mindset to effect this change. Everybody wants to see the magic of digitalization, right? So whenever you are providing change, no matter how small or little the digitalization may be, it's good to always have that digital mindset to say, how can we use digital transformation to effect this change? Instead of sending papers, right? Mails, papers, let's send emails. Something as simple as that. All right. Okay, let me have a look at the time. To avoid information overload, we would take a short 10 minutes coffee break before we continue. So we will be coming back before we go for the coffee break in the next 2 minutes. Any other question? Do we have any question before we go for our coffee break? No question? All right. So let's go for our coffee break. I do not want to overwhelm you with a lot of information. So I would set a time here where we can come back. It's just 10 minutes. It's 10:19 now. So it's 10 my time, 19, I'm sorry, but you know what I mean. So in the next 10 minutes, wherever your time is now, just add 10 minutes to it. So see you all in the next 10 minutes. So stretch, do some stretching, go to the toilets, and then we'll be back. Okay, welcome back, everybody. Welcome, welcome, welcome. Fantastic, Melissa, thank you. Thank you, Rudy. And thank you all for continuously engaging. All right, so I hope you had a good stretch of your legs before we start again. The first thing here I would be talking about is stakeholder management. As a project manager myself, I have found that your ability, and I think I mentioned this earlier on, to influence people would really help to make key decisions. It's one thing to talk to people, is another thing to influence their decisions. Depending on the type of people or the type of person you are engaging with, you want to know what content you are providing to them to make decisions. Now, you may not necessarily be providing benefits of so for a patient or for a patient, you can say the benefit of this change, if we're using Charlotte's example or Charlotte's situation, is that you would be able to get free medicines, because when the doctors that you're consulting via video can see that, can understand your situation, they will give you free medicines, right? That is the benefit for the patient. But the stakeholders, the other stakeholders at the other side, these could be the hospital management team or the sponsors, people that would bring money for this change, is quite different. In this situation, for the hospital management, it could be that at the end of the year, we're going to be getting the highest reviews as the best hospital around that area. Do you see what I mean? So different stakeholders have different perspective and different end goal. The sponsor that is providing you with money or resources or medicines wants something for themselves as well. It could be they want you to mention them somewhere. They want you to, include them as a sponsor on your website or something like that. Every sponsor or every stakeholder has a goal. You need to understand their goal, and this is where stakeholder management comes in. In my place of work, I know just by looking at that stakeholder, I know what they want already. Especially in a global environment, you will know that these people want something as simple as recognition. They want recognition. So what I do, sometimes people are very easy to work with once you understand people, no matter how difficult that person is. So I understand that this person wants to be recognized in front of their boss because I want something from them. I would make sure that the day the boss is there, I would say something nice about them to get their buying. You know, I could say something like, I want to thank, before I start this meeting, I want to thank, for example, Musa, who has been very active in this, in this project. He has been collaborating well. And I just want to say thank you. Honestly, you've been doing well. I want something. As a project manager, you need to be diplomatic. And of course, you need to also mention something that that person is actually doing, right? So that it doesn't seem like you're lying to the person, but it has to be something that is distinctive, right, for that person, so that that person knows that you're not being shady, right? So every stakeholder has their own goal, and it is your job as a change manager, as a change champion, to understand what they want. This is why it's one thing about listing what they want or what you want them to achieve, and then also listing what they want to achieve just by your understanding. I would always say this as a project manager and as a change manager as well, because most of the times as project managers, we find ourselves also implementing changes based on projects, right? So we want something from the stakeholders. They also want something from us. I'm listening to what they are not saying. Most of your hospital management team, there's something they are not saying that you need to know. It could be that you are in a meeting with very high top people and they keep repeating something. They may be saying something like, at the end of the year, we had already planned to reduce this cost by this percentage, right? In your head, without them saying anything, they want to reduce the cost of a particular thing. You can leverage on that to say, do you know that if you bring these devices to this place, instead of you thinking of reducing costs, let's think of increasing, instead of you thinking of reducing costs, let's think of increasing your profits. So you are bringing in the device to Charlotte's local context of that area. However, because of what you have done and because of the engagement you've done with these people, they are able to trust you for you to bring another device and get another contract around that environment. So they are thinking, right? They're saying it actually makes a lot of sense. Or in your hospital, the management team, they always want to have, the greatest reviews. If you're in the UK here, everybody wants a good review on their website. Everybody. So sometimes even a general observation for myself that, look, people want a good review. They don't want their website to be carrying 1 star or 2 stars. No, they want 4 stars. So how do I combine this with my own goal, right? This is stakeholder management for you. Anything that you feel that it would make sense for me to help these people so that they can help me is very, very crucial for you to understand. Now, what is the process of stakeholder management? The first thing you need to do is to identify your stakeholders, which we have done for Charlotte's team. We talked about the telecommunication team. We talked about the patients themselves. We talked about the hospital staff and the management, people who make decisions, and all of those people have been identified as the key stakeholders. Another thing could be the sponsors, people that would bring money to this change, like Charlotte has mentioned, because sometimes money could be an issue. But like I said, from experience, money is also everywhere. It's just for you to do that research, have a process. These things don't happen at the snap of a finger, right? Have a process, document, ask questions. There's this girl she's African and she's going into politics. She's already into politics, very young girl, right? And when you see her speak, you know that she has a lot of knowledge about politics. If I were a politician, right, and I want somebody that would lead in the youth something committee, that's the person I would choose. She's not even Nigerian. She's, I think, is it Botswana or Gabon? Honestly, but I know she's African. That's the person I would choose because I have the perception that she has a lot of knowledge, right? So if I want to be the sponsor and I have money, I don't know where to, use what to use my money for, or I want to use my money for the right cause, but I don't know who to trust. Just by looking at her, following her social media status, understanding how many places she has traveled to, I can trust her with my money, right? It's an example. Okay, so identifying these people, also identifying your key sponsor that can bring about this change with the resource you need is very crucial. But it comes to the sense that you have to start small, especially if you're just starting. You have to build your portfolio, right? To say, when you are reviewing, apart from your own your own, the main role you have in your organization, you also have to say, what else have I done outside administering to patients? What changes? What can I? What's that small thing I can do in this place? Once you have done that, you write it down. It's a goal, as simple and small as it is. You consult people, and then you categorize them to say, sponsor, telecommunication, patients, hospital management. So we've identified them. Now we analyze these people. You have to analyze your stakeholders to say, what do they want? I think I've said this at the beginning. What do they want? How can I help them to help me? Many people are looking for people to help, actually. It's just the trust issue. So if I want to reach out to, for example, Facebook, for them to, or the Meta, for them to sponsor me, what are their values? How many people have they helped? Who do they like to help? Because most of these organizations, they usually have a yearly thing where they provide support for other organizations. So it may not be Meta, it could be a health organization, WHO and all of those things. You can say, what is their goal? You analyze it as your sponsor. What does my sponsor want? And how can I get to his mindset or her mindset? So you analyze. Then you analyze your patients as well. Who is their chief, their chief or their king or whatever in their place? What does the king want? The king might say, look, I want to keep our culture. I don't want anybody to come and spoil things for us. You've understood them, you've analyzed them, you would plan it in a way that it doesn't affect what he has said. Right? Or if you feel that this person is saying this because he or she doesn't really know the benefit of this thing, because of what they have said and I've analyzed it, I would provide a very fantastic guideline to gain their buy-in. Some people want to present to stakeholders and you start to use technical jargons, right? Digital transformation, you're talking about digital transformation. You know that you are the subject matter expert. You know all of the technical jargons, but you won't be telling a king or in an organization, in a local place about digitalization of internet connectivity. Just like, what's your problem? You have to use their own language, right? You have to plan in a way that you could use pictures, you could use videos, all of these things to ensure that they understand your own point of view. Now let's shift from Charlotte's scenario and let's move to a hospital, right? You're in the hospital, you're seeing that this particular head of department in the hospital is really very particular at being organized. You know, some people like organized, they like being organized, right? You can use that perspective to gain their buying. To say, if we start to use this in the next 2 years, we would reduce the chaos, or how do I put it now, to ensure that everywhere is organized. So it's always good to analyze and then plan and then engage. Engage in the way that it could be training. It could be that whatever you are presenting to them is clear. I'm always very thankful that I started as my first career after I concluded my university was teaching, because it helped me to be able to explain to a 5-year-old big things. So it helps me to when I meet key stakeholders, right? I sort of look at them. Most people don't want jargons. Just provide something simple and results, numbers, KPIs, right? To say, if we can introduce this change, if you can remove 20 folders and impute them in the system, right? It would reduce the time for the patient's visit from 20 minutes to 1 minute. They want to see that. That's what they want to see. They don't want to see, okay, you know you're going to provide, you are preferring digital transformation, right? But you don't need to communicate that way. You need to simplify your terms. I know there are doctors here and you guys like big English. I'm just joking. But you need to ensure that your terms are simplified in a way that people don't feel like, what are you saying? You know, you're all dressed up, fantastic, but you come to present something and it's just technical jargons. The people who you need to communicate the technical jargons to are the people we call the developers in the IT space. Those ones, when they start with you, you as a professional, a healthcare professional, you just be tired of them. Just say, look, this is what we want. Don't speak codes to me, just do it, right? But you as a change manager will need to simplify your words. Every stakeholder wants what? Result, 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 projected results. Even the patients want projected results, right? So this is how stakeholder management works. You first identify your stakeholders, you analyze them based on their interests, their thirst, based on their values. I have there's an upcoming conference that is coming, maybe that is coming. And I spoke to I was speaking to one of the speakers, and she said, what is the values you share? I mean, it's another company, not mine. What are those values they share? Because if I share the same value with them, I will be able to show up. This person is a friend to Elon Musk's mother, right? But she was like, if they don't share my same value, I'm sorry, I can't come. Because some people, while some of us are still young, right? The older people, the sponsors, the people that have money, they always want to know the value you are providing. So you speak to them in value language, right? So this is how you can manage stakeholders, identify them, document, analyze, plan, and then engage them in a way they understand easily. Let me have a look at the comments. Yes, layman language. So Tommy says it's very important to be able to break down complex ideas into tiny, understandable bits. I cannot tell you how important this is because let me give you an example. When I came to my organization, I started to notice something. The communication was too complex. These stakeholders will come and be nodding their head. They don't know what you're talking. They don't know what you're talking about, right? They're just nodding their head, nodding. And then before you know, the people from our team, they will say, no, we're not approving your project. Just like, what's going on? Why? I said, okay, let me be the one to develop this document. I'm not perfect and I'm still learning, right? But I said, let me be the one to develop this document in a simple way. And within that 30 minutes meeting, they just said, okay, we understand now. Now it makes a lot of sense. And of course, the Nigerian in me, my head was just swelling. Now it makes a lot of sense. Let's do this. Let's start. Because the developers, right? Because there was no project manager at that time. We're just talking about technical jargons. They don't know what you're saying. Just give me results, right? And this is one skill you need to acquire, even in the healthcare sector as a change manager. Be able to speak the language of a layman. People are simple, but we like to just complicate things. All right, let me have a look at the chat as well before we move on to this topic. Yeah. All right, so stakeholder management in digital transformation. Like we said, identify and engage your stakeholders early, involve all the key players. This could be nurses, doctors, pharmacists, administrators, and the IT teams, because all of you who are moving to the digital healthcare space, you would start to engage with IT people. And if you want to be that person like a change manager or even a doctor who wants to make changes in their organization, you need to start to understand some technical bits of it. You must not code, you must not do some really techy stuff, but you need to understand how the tech system works. Usually it's followed by a software development life cycle, and it's a framework as well, right? You just need to know all of the big high level summary of things so that you can engage effectively with them, because it could be that you would, once you are trying to implement change, you could be the middleman, right? Where you would speak to nurses, you would speak to patients, you would speak to probably the chief of that local local community. You could be speaking as well to sponsors, people that are very exposed. So, and then of course, then you need to speak to the tech people. So you need to ensure that you are engaging them well and communicating clearly. I think I have overemphasized that communication as well. Tailor your communication, highlight benefits to each group, like I mentioned. For doctors, these are their somewhat their goals. For nurses, easier follow-ups and medication tracking. Administrators, cost savings and improved service delivery. Clinicians, involved in design through user group and pilot programs, address workflows, concerns for buy-in. Okay, so you can see that every single stakeholder here have their own goal. So you cannot be telling a doctor that, yeah, come, let's design things through user groups. The doctor will be like, what's the problem? I just want to ensure that I have good records of my patients. I want to ensure that the workflow is really streamlined and the process is effective, right? So you need to always ensure that you are on top of your game when you are tailoring communication. Encourage collaboration, ensure that you facilitate open discussions between teams to build trust and alignment. Be very, very, people want to see that you're honest, right? When I started my career in product management, I started to see a lot of fantastic things, especially working in a global environment. You see people say, I don't know it. I don't know it. Let me read about it. But I feel as an African, I used to have that mentality of I should know everything. I don't know it. They'll be like, look, I don't know. Let me come get back to you. And it's okay, it's really fine. In fact, if you say you know everything, they start to suspect you like this person actually honest, right? So always be honest, encourage collaboration, build trust, right? Have integrity. If you say you're going to do something, please do it. Whether you gain whether you gain from it or not. Once you have said it, people hold you for your words, whether you know it or not. Where I work, if I know the people that will say, don't worry, I'll submit it to you, and they won't submit it. If we're thinking of recommending someone, I won't recommend them. I will recommend people that will say, don't worry, I'll submit it. Even if they don't submit it immediately, they submit it the next day, they've done their work. So have integrity. It will also build trust when you are trying to implement change. Imagine if you have not been coming to work and people don't even know where you are, you just show up anytime you want to show up, and then you say, oh, I want to implement change, I want to digitalize the way we use things here. People may be like, what's this one say? What are you saying? Right? So it's always good to encourage collaboration and ensure that you are trusted. Okay, let me have a look. It's usually said that if you can't break down complex ideas, you really don't understand it. Yes, 100%. And the truth is that you need to continue to break it down for your own understanding as well, so that you can explain to a 5-year-old. I always say this when I want to have a presentation. I say, if I can explain this to my child, then I can explain it to these big fathers and mothers over here, right? So your ability to be able to break it down shows that you understand it very well. Thank you for that. And I think I need to continue to rephrase that in my head, especially when applying it to projects. All right, so how do we leverage technology to support change? Analytics, data. Data is the new gold in the IT sector. Your ability to understand data and use it to your advantage would make you stand out as a change manager in the healthcare sector. Utilize advanced data tools for tracking transformation, progress, and measuring impact. Now you want to move your hospital. You want to move your organization, your healthcare organization, from A to B. What are the numbers in A? You're trying to develop an app that would help them to be able to supply medicines easily. So what was the numbers of supplying medicine manually before? Where are you taking them to regarding that? Right? And there are so many tools online these days that you can use for that. we're thankful for AI. So once you have been able to get these numbers, of course, with key stakeholders, because you can't do it yourself, you may need to meet admin, you may need to meet the pharmacist in the pharmacy in your hospital to say, how do you get supply of medicines, right? How many times in a week and all of that? You gather your information, you use a tool to save it, an analytic tool to save it. There are so many. Google Analytics is one of them, right? There's so many where you impute this, and then you can also project based on your your what you want to do, how this would solve these supply problems, right? Virtual learning platforms implement scalable digital education programs for continuous skill development. So, for example, you've provided the guideline. Let's say Charlotte has provided a guideline for the internet connectivity and how to use it within that local community, right? And she has done this. Here, she has done this fantastic guidelines. However, more people want to use it in more African countries. Startups can start to look for virtual learning platforms to create an educational curriculum to follow, right? Charlotte is coming to Nigeria, for example. I don't know if that person is in Nigeria or not, but let's say that Charlotte is coming to Nigeria to help a community in Nigeria to expand, to provide internet connectivity. But they just get there and it's like, the local community where I was and I've solved this problem, they were 20. But I'm coming to 100. How do I teach all these people? I need a platform where I can impute all of these educational, all these subtitles and titles of things, so that these doctors and nurses here can just click on it and gain all the guidelines they want. I hope you're thinking outside the box of things you can do in your healthcare sector to make changes. And this virtual learning platform is one of them. As you keep growing in your knowledge, you need to ensure that your whatever you are putting in place regarding guidelines for change is scalable, right? So you can be thinking of something now and saying, how I just wish that all these nurses can just get good guidelines. Look for a virtual learning platform. Some of them are not even expensive as you think. Recommend it to your organization to say, once any new hire comes, right? Once any new nurse or doctor comes or admin comes or whatever role that might be there apart from nurses and doctors, whenever they come, let them get to this platform and get all the learning process of how our hospital works. And of course, you need to also make sure that that platform is being improved as you go along. Do you see what I mean when it comes to changes? All right. Let me have a look. Digital onboarding, Melissa. Yes, that's what I was trying to refer to. Thank you. Rudy said that's his job. Fantastic. Beautiful. Now imagine that Rudy, right, has these things in place. And Rudy is let's say Rudy, sorry, I don't know if you introduced yourself at the beginning, but let's say Rudy is in Tanzania and we need Rudy in Nigeria, right? He already has this platform, these guidelines, and he said, we need Rudy. Please come over. Let's introduce you to our team. This is how our own process works. We want you to use that process, we want you to use that process, but customize it in our own way. As Africans, I feel like we have a lot to do, a lot of interesting things to do, and a lot of changes to make. And I mean, 23 of you here, all of you can make that change, including me. Collaborative tools, use cloud-based solutions to enhance communication and workflow coordination. Very, very powerful, very good. Predictive modeling, employ AI-driven insights for anticipatory change management strategies. So what does this mean? All of this English. You can use an AI tool to predict where you want to see yourself based on the information you provide the AI with, right? You can use collaborative tools in the sense that instead of you to start looking for WhatsApp, yeah, WhatsApp is a collaborative tool, but when you're working in a more sophisticated place, right, you want to use, probably want to introduce, if you don't have it already, your organization to a collaborative tool like Confluence, Jira, Basecamp, Asana, all of those tools that everybody can communicate with and upload documents on if you don't have it already. Okay. So these are the ways you can leverage technology to support your changes. Let me have a look at the comments. Trello, for example, fantastic. Yes, yes, thank you. Thank you so much, Rudy. Zoom, exactly, Zoom. However, Zoom is in a way that it's collaborative on videos and all of that, but a platform where you can upload all the, although does Zoom have that, but they keep improving. But I know of one very good one, which is Confluence and Trello as well, right? Where you can just organize all your documents, and then you can use these virtual learning platforms, this one we talked about, to guide people on what process is working within your organization. All right. Let me keep looking at the time. Okay, we are good. All right, so let's move on to the next one. How do we maintain? Is wanting to develop and is wanting to maintain. One of the things we sort of suffer in Africa is maintenance, right? But you as a change champion would be able to maintain your process once you have initiated it. The first thing here is continuous feedback loop. It's one thing to have a platform where you can, a tool where you can collaborate. Is another thing to ensure that you check for improvement in that platform. The people who are providing that platform, for example, Confluence, you can keep telling them, because I use Confluence as well in my place of work. You can keep, we started to reach out to them to say, this thing is not working for us. So Confluence as a whole, first of all, will always ask us to provide continuous feedback for them, and we would always continue to provide feedback. So if you are the person implementing the change, you should be asking people, how is this thing working for you? Has it made your life better? What can we do to improve it? Right? That is how you maintain what you have implemented. The next one is the skills development pathway. Creates clear career growth opportunities tied to digital transformation competencies, right? When you are making change, like we talked about Charlotte's situation, if Charlotte is providing a guideline for change, Charlotte should not provide it on paper. Charlotte should ensure that he or she provides it in a platform. Charlotte should ensure that there is a training video to help use that platform, so that we don't go back to our old ways, right? Everything is changing, and Africa is not left behind, because we're so smart and so intelligent, right? So many ideas sometimes I hear, I'm just like, what? So ensuring that we use digital transformation pathways to implement our changes is very, very important. Of course, you have to celebrate milestones, right? Conduct periodic events to acknowledge process and reinforce new processes. You need to congratulate them. You need to tell them, oh, fantastic work you've been doing. You've been, just to ensure that those other people that are resisting the change can buy in. Because some people might not still be using those things unless it's enforced on them. But let's say they are not using it. You start to praise those people that are using it so that those people feel left out. And then, of course, adaptive flexibility, stay alert to industry trends and be prepared to evolve your transformation. A lot of things are improving. AI is just all over the place. AI is fantastic. AI has helped me to improve if there is any of that guideline periodically. Stay alert. Ensure that you are in different groups, right? LinkedIn have a lot of AI groups, right? Digital transformation groups. Telegram has a lot where you can just join and start to understand terminologies. What is going on? What are people saying? Is it ChatGPT that people are using, or some people have left ChatGPT because I feel like ChatGPT is just too generic? There's so many other AI powerful tools that you can use that is streamlined for what you want, right? So what are those tools that can help me to evolve? What are those tools that can make me 5 times faster than my competitors? Because you would have competitors. While you're thinking, other people are thinking as well. Can you hear me now? Okay, I'm back. Okay. Okay, thank you. All right. Now, we have a small class activity. We are really, really good on with time. By 11:30 my time, we should be done. So that's really good. All right, so we do have a class activity, and I want you to think outside the box, right? I would read it out to you, and then you would really think. And if you'd like to unmute yourself to, really explain further, that would be appreciated. But let's please pay attention so that whatever we have discussed here, you can apply it to your own everyday life. And even if you are just considering some changes where you are. Now, look at this scenario. Implementing a digital patient management system in a hospital. A mid-sized private hospital in Africa, for example, Hope Care Hospital, is struggling with outdated paper-based records. They're also struggling with long patient wait times and miscommunication among healthcare professionals. The hospital's management has decided to implement a digital patient management system to streamline operations, improve patient care, and enhance efficiency. Digital Transformation Initiative. So this DPMS will digitize patient records, appointment scheduling, billing, and internal communications among healthcare staff. This will allow doctors, nurses, pharmacists to access patients' histories in real time, reducing medical errors and improving decision making. So in the sense of this, they were using paper and they want to digitalize it. They were using records. They were recording things on papers, but they want to then transform all of these records to a platform, right? A system where all of these things will be recorded. Now, what is the activity? You can unmute yourself if you want, or you can type it in, but I would want 21 of us. Oh, no, not including myself and the host. So I would want 19 of us to provide some common, let's start with some common resistors in this particular scenario. So you can just raise your hand up, verify by raising your hand up, or you can type it in the comments. What do you think? Let me go back to the scenario. What do you think would be the common resistors here? What would be the resistance here, just from your perspective? It doesn't matter if you're wrong or right.
There's a hand up, Ibinabo.
Yes, please.
Good morning. Can you hear me?
Hello, I can hear you.
Okay. So this particular
I think it's a bit muffled, Ibinabo. Do you have a headset or?
Can you hear me better now?
Perfect. Yes.
Okay. So I was using an earpiece. So this particular task is very close to my heart because I recently joined an organization that now uses a HIMS system that is very difficult to understand. And I was coming from a government hospital, which was a paper-based So I would say, honestly, learning the technology, because you would also not want to make mistakes, because with
Yeah.
paper you can copy. But now with technology, if you've posted something, you posted it, and you start having to go back. So I would say one of the major challenges or resistors to it would be learning the technology or technical know-how, because on some days when it gets really tough, I find myself saying paper and pen would be easier, but I know it's not. So yeah.
Okay. Fantastic. Thank you so much, Ibinabo. It's close to your heart. So once you've learned this, you are going to back to that government to initiate change, or you can initiate it. So she has mentioned some. I'll just writing it down and we would write it here, and then we would also discuss. I would also look at the chat box. Difficult to understand was one of them. Difficulty understanding. Poor technical know-how is another know-how. Okay. And then there's a possibility of imputing mistakes. All right, let me have a look at the chat. I like this class. Okay. Resistance to knowledge. That's a good one. Let me see. Hopefully I'm not missing anyone up. Resistance to technology. Like Ibinabo, she was like, are you sure paper is not just better? Oh, technology. Okay. Resistance to technology, lack of technology. Becky, thank you. We've captured that as well. No technology know-how. Let me go down. Esther says healthcare professionals and staff. What about them? They would be resistors, right? That's what you mean. So healthcare professional resistance. Let me just put it like that. Another one would be digital literacy. Yes, that's the technical know-how. From healthcare, lack of funding from administration. Lack of funding. Fantastic. Okay, let me add more tables. Let's see. System complexity. Where I've been used to paper to work, yes, so that's a resistance to change, Charlotte. Comfort zone, that would be their habits. Complex, Mbe says complex, system complexity. System complexity. Our table is becoming very big, which is good. So let me add some more. Okay. Reduce patient care quality if the systems are not interoperable with other hospitals. So integration as well. Poor system integration. Poor system integration. So many good ideas. And then we also have comfort zone. So old habits. Old habits. Let's see. Okay. Workload concerns. Good stuff. Workload concerns below. So we have workload concerns. All right, let's stop here. Thank you so much. Beautiful. We're doing stuff, good stuff. Okay, so now we've identified some resistors based on this scenario, right? Can you tell me, based on what we've identified here, as a change champion, how do we resolve this difficult to understand and poor technical know-how? You could unmute yourself if you want by raise of hands, or you could just type it in the chat. We're handling the first one now. Difficult to understand and poor technical know-how. What do you think?
Charlotte or Ibinabo, whose hand was first? Charlotte, let's go with you.
Okay.
Charlotte, you can unmute yourself. Okay. Okay. Melissa.
Training and support to staff, to healthcare workers.
Fantastic. Thank you so much, Melissa. So let me type in that, training and support for the staff. So Ibinabo is having this problem of where do I even start from, right? Where do I start from working? I don't even know where to click on. If the change champion does not have a process, a well-defined guideline and training, there's a possibility that everybody in Ibinabo's organization may be facing this. And some of them, they don't say anything, right? So what can, in this situation, what can Ibinabo do? Let's say Ibinabo has finally gotten the technical know-how. She would look for somebody else that is a bit techie, and then we find a way to train the rest of the people, whether they want it or not, right? You develop a very not perfect, a very good guideline to say, click on this, very simple, or a video. Video works better for people, really, right? To say, we know you don't know how to use this thing, but this is the way I have used it and I was successful. You as a change manager must know this change management process like the back of your hand, so that you can explain to people like we talked about, so that it can be so simple for them that, have you seen people that use video, they would pause the video, they'll go to the platform, they'll click, pause the video again. So you have to ensure that you train the staff, you provide a very simple training technique for them to be able to understand this technical platform. Okay, let me have a look. Training and support, beautiful. All right, so let's move on to the next one here. What is the possibility? What is the change? What should the change champion do, right? When the resistance would be that there's a possibility of imputing mistakes. What do you think? Exactly, Tommy. The know-how has to start from the change agent. Thank you so much, Nuran. The quality assurance team. Remember, it's a platform, first of all, right? While the platform, whoever is responsible, whoever has built that platform should be able to ensure that there's a reduced way to make mistakes. And then, if mistakes are still being imputed, a quality assurance team should be put in place to ensure that because they do it everywhere, even in my place, right? Or the previous place I was working, you would write your reports in a file. Somebody else is coming to check what you wrote if it's correct, right? So quality assurance team would be best for this. So let me write it there. And then, of course, also consulting the developers to ensure that, or whoever develops the platform, to ensure that they keep imputing mistakes. Is there a way we can change the design of this thing so that they can, once they see the design, they can know what to impute? Okay, so quality assurance team. Resistance to technology. Why are people scared of technology? And what do you think as a change champion you should do? Why are people scared? Why? Can you tell me, or anybody can unmute themselves as well, to say, why do people resist technology? What should be the change champion in this situation? Remember, if someone is resisting something, it could be they don't understand it.
I think explaining to them the benefits of the change, of implementing the change, would make them adopt the change.
Exactly. Yes. So they are resisting it because they're just scared. Thank you so much, Melissa. They're just really scared that hope it doesn't go and show off that I don't know how to do my job. See what Tommy says here. Sensitization usually fixes that problem, right? So let's write it here. Resistance to technology. So what you can do is to explain the benefits. You explain the benefits to people to say, do you know that if you're supposed to close by 5:30 and you use this platform, do you know that, and use this platform, right? Do you know that you can, by 5 o'clock, you're done with your work? Look at me, I'm done. Do you see what I mean? Any way you can use this, anyhow, just to make them to be comfortable. And of course, you have to give them time, but just to make them to be comfortable with using that technology. And like I said, once people understand that, understand what they are doing, it's very easy to build their confidence. It's something that I have learned as well personally, that once I have confidence in, once I have knowledge in something, I actually just naturally have confidence in it. Okay? Fear of work, because of fear of workload increase, yes, motivation motivates the change with small gifts. Fantastic. Give them gifts, right? Praise them to say, oh, look at you. I will want to thank you for, so Ibn for example, Ibn want to thank you for using our platform. You've done well. We've seen you make progress. Even if it's via email, it must not necessarily cost a lot of things. We want to thank you, and you are the change manager, so you have to have that in your plan to reinforce, to praise people. We want to thank you for using this platform. You've done so well. If you need any help, let us know, but we just want to encourage you to keep going. Ibn will sit down and say, oh, I'm actually really doing well. So I'm even trying, right? So let me add that here, motivate the team. Now, these guys, healthcare professional resistance. Let's read, let me read the chats. People are having fun there, so let me just check. And preference to traditional methods, yes, the fear of the unknown. People are really scared of the unknown. But like I said, if you continue to, I'll give you an example of my mom. She doesn't like using technology. But I noticed that once I sit down and say, okay, you see this red thing here, click on it. Once she sees working for her, she'll be like, oh, okay. Thank you, I can do it now, right? So everybody just wants to, that fear of the unknown, that maybe I would spoil something if I click on this thing. But if you sit with them, train them, motivate them, show them easier ways, it builds their confidence. All right. Provide incentives for adoption, yes. Engage the doctors and nurses in making, Ude says corruption. I get you, Ude, like, okay, so the healthcare professional resistance is what we have just answered. Nuran has just answered, right? These guys can frustrate you. So it's just to continue to engage them in decision making. You'll see someone that you expect to be educated and you're trying to provide the solution, but because of maybe their ego or something, they want to, just, put it off. But sometimes as a change manager, a project manager, somebody who wants to implement change, you know how to get to them. You make them make the decisions but it's your decision, right? Just make them feel big because you want to do something, right? So you engage by engaging them, making them look serious for them to gain that, for you to gain that buy-in for decision making. All right. What about lack of funding? Lack of funding. What do you think a change champion should do when there is lack of funding? Anybody? Yes, Melissa?
Is it lack of funding or lack of motivation to mobilize funds for that particular project?
Yeah, either of them. It could be the cause of lack of funding as well. Yeah. But what do you think could, would provide, what do you think would be this resolution for this, for lack of funding?
If it's lack of mobilization to release funds or motivation to mobilize funds, I think maybe data analysis of the present revenue of the particular environment they are using, then focusing on, okay, if, for example, if we decide to implement this change, you can focus on like how much revenue to generate. If
Yes.
it increase the revenue of the hospital or the health facility or the organization, it would actually motivate the stakeholders to release funds for that particular project.
Yes.
So that's what I think.
Yes. Thank you so much. Yes. So what Melissa is saying is provide data to make informed decisions, right? Provide data to tell the key stakeholders. And what I've been seeing with you all is saying engage the stakeholders. Provide data for the stakeholders for them to make decisions, right, on how to provide funding. Give them that projection of where we are headed to. And even if they don't, you need to continue to reinforce that this change will make a lot of it will increase our ROI. If they continue to resist it, start small. Say, okay, how about we start buying only one laptop? I mean, we can fund that. We can buy just one laptop. Let's start with that, right? So you can use different ways for this lack of funding. Charlotte says here, do advocacy to raise funds. Look for these guys that, and most of them are there. I'm telling you, they're there. Look for them, raise funds, create awareness. Remember our ADCA framework. Create awareness that, look, something is happening. We want to make changes. We are moving from this to this. This is the projected costs that we will be saving. Always look for the positives when you are trying to implement change. So let's write it there, provide stakeholders with data to make informed decisions. Advocate. How did Charlotte put that? To raise funds. To raise funds. I'm seeing some more. Engage the stakeholders. Do a cost-benefit analysis, of course. Explore grants and secure budgets. So these are fantastic ways to make to look for funds for the change that you are doing. I'm just right-clicking and copying what Nuran has said. Okay, what about the system complexity? I feel like it's connected to understanding the system. But what about the complexity? How do you think we can provide change? Mapping out a transition plan. Okay. Beautiful. I'll just copy that as well. Thank you, Mbe Marvin. For complexity. Because
yes, can you hear me?
Yes, I can hear you. Go ahead.
This is Winston from Kenya. So
Hello.
when system complexity, I will say that in an organization, you need to have a structured approach whereby maybe you actively engage and involve the team to drive a certain change. And this one comes when you have a well-connected system that there's an interaction between the staff and engaging with colleagues. If there is, especially when it comes to digital health, you will have to engage colleagues, and then you have a way to advocate for your new ideas so that you come out successfully with your change, because implementation causes many problems, and it can make different levels of organization to have different views. So I will just say that maybe you just focus on the large scale impact from the top to your colleagues. That's all.
Fantastic. Thank you so much, Winston. Thank you. Fantastic. So, like he said, providing a structure, a process, anything that is complex can be broken down as far as I'm concerned. So providing a structure to integrate these systems together would help, it will help to provide stakeholders with where we are headed to, right? So which is really important. Another comment was mapping out a transition plan. So I would also write what Winston has said, creating a process, a structure to reduce complexity. And of course, as you know, it will still streamline to working with stakeholders, your colleagues. Everybody must be involved. You cannot do it on your own. You'll be surprised how teamwork can really improve your work. So Nuran has said, simplify the system design, provide customization. So of course, it's always good to simplify them, and it will help to reduce complexity. Simplify the design and customization as well. Because what may be working for one hospital, I think we still raised this as well, what may be working for one organization might not work for another organization. So it needs to be customized based on your own needs in the organization. I think this poor system integration would also, I think this is also addressing it, simplifying the design, right? And of course, customizing it as well. Apologies, I have cleaned up this customization. So we'll move on quickly to the next one. All right. So what about comfort zone, old habits? How do we leverage it as a change champion? Comfort zone. What do you think? Yes, process mapping, of course. And all of you that want to transition to the IT space, if you are able to gain this process mapping skill as a business analyst, it would really, really, really help. It's a powerful skill, right, to have, because people are looking for how to improve their process, okay? All right, so comfort zone. How do we address comfort zone? Showcase success story of early adopters. Fantastic, yes. If people start to see, does somebody want to say something? Okay, maybe not. Okay, as I was saying, oh, cancel. Apologies, I'm trying to navigate myself back to. All right. So as I was saying, if people want to, I've lost my line of thoughts. So let's just go to comfort zone. If you want to leverage people's old habits, how do you do that? Showcase success story adopters. I think that's where I was before I got a bit distracted. Let me just copy that. Because somebody has an old habit, but if you just show them that, look, you guys are behind, because people like competition. You're just like, you are behind. This other organization have started doing this. Look at what they are doing. They might be convinced, right? Let me check for others. I'm so glad that you guys are sharing great ideas. They need to see the benefits, exactly, Tommy. They need to see the benefits of moving away from what they are comfortable with. Provide incentives. This one works well even for me, Becky. It works well for me too. Just provide something that's like, look, see, if you do this, you would get this. You get 2 days off work. And I'm like, yeah, count me in. Okay. Scientific discussion using data so that people can understand change. Yes, exactly. Mezeke. I hope I'm not pronouncing your name wrongly. Encourage peer-led learning. And this is taking us to the next slide. competitive analysis, right? Showing them that, look, you're behind, so better wake up. What about the last one here, which is workload concerns? You know, sometimes people might see this as an extra workload. Do you know? You're trying to provide solutions that would reduce their time, but they're seeing like, look, you're going to add extra job for me. I don't want it. So how would you provide this? How, as a change champion, what do you think you would do? Streamline the workflows? Yes. What else? What do you think you can do to reduce or encourage them that this shouldn't be a concern? Automate the task routines, of course. So of course that you should be considering that when you are providing this change, you are also ensuring that the system should automate some tasks so that the workload is not a lot. But what else do you think for workload concerns? Reduce staff workload, okay. Well, one thing is this: if they are thinking of workload concerns, you need to understand what kind of workload are they talking about, because this particular system is being brought about to reduce the workload. So it could be that they don't understand how it works yet. And this is where training comes in as well, and data to say, what workload are you referring to? Are you saying that this might be an additional workload for you? Here is how it won't be. This will be automating your task. This will be doing this, and this will be doing that. When you are supposed to be having a meeting, instead of this particular paper, gathering papers to be taking your time, you can have your meeting. Even at the meeting, you can be inputting some things. So you have to train them to say that it's actually reducing your workload. Regularly collecting staff feedback, of course, to show that they are not, other people are doing well. Delegation and automation of work as well. All right. So these are some, thank you so much. This class activity was really mind-blowing, and you can see that we have already provided some solutions as change champions, leading us to the next last slide, which is a call to action, which I think it's Nuran that also suggested this as well. So in your digital transformation role, as you are changing things, right? One thing that would help you is leading by example. Know it in and out. Whatever you're trying to change, know it in and out, and look for those people, like I mentioned earlier on, that are already, maybe technical, they have this technical know-how, they always want to learn, they can adapt easily to things, so that they can also impress it on your other colleagues, right? Mentors as well can help you, right, to share knowledge and support less experienced healthcare professionals in tech adoption. In some organizations, there are some very strategic mentors that can help people to, sort of rise to the digital transformation mindset. And then the feedback providers as well actively contribute ideas for improving and expanding digital health solutions as well would help. Okay, so I would take questions now, and then we would close this session. What happens if communicated benefits are not met after implementation of the change? Good question. Now, when a change has been implemented, right, and the expected benefits did not really match what you had presented, you have to be very, very honest with them. There may be some problems or some issues as to why these benefits was not reached. It could be that you need some more time to reach these benefits. It could be anything. The thing is that when you're in a situation like that, you have to communicate. You have to let the stakeholders know that we're expecting to meet with this benefit. However, it has not come to fusion because of these issues. It happens to the best of us. We're working with a project, right? We expected that the project would do well. However, there were some constraints in between the projects. My job is to communicate, right? Is to communicate that, oh, we're meant to meet this, but we couldn't based on this. However, let's keep monitoring this. And if it doesn't work, there is a possibility that you can halt it. It happens, right? To say we were going to bring in headsets, for example, to help with patients that are having hearing problems. We're going to bring 15. We started with 5. However, it's not working the way we wanted it to work based on our patient's background, something like that, right? From my experience, because it's not working this way, why don't we keep this 5 and halt the listen to halt the change management implementation. We go back to gather feedback and get more information to be able to improve our process. It happens, right? So it just depends on the situation of why the benefit is not being met at that time. It could be that you need more time. And sometimes, I mean, when you provide information for, when you start a project, it could be that it's not that time it was meant to start. So the benefits of the timeline you included has changed, right? So all you need to do is just communicate. Okay, any other question before we round up the day? Any other question? I would give it a minute before we close. This is the last one. Yes. Okay. If there are no questions, okay, there's a question. What if the project is time sensitive and you're dealing with a lot of human resistance, evidently, I don't know why this thing keeps blocking, evidently stalling the implementation time? Now, in a case like this, right, where the timeline is being affected, you need to ensure it's not something that you can control, but you need to ensure that the people bringing the money are the ones that are being updated. It's one thing for you to help with, help you're trying to help the patients, but they're not corresponding well as you want them to be. But you need to keep communicating with your sponsor to say, we are facing this challenge, because most of the time people just want you to be honest, right? We're facing, and they want facts. Why are you facing the challenge? We expected that 5 people will be using this device. However, they're not even showing up to work, right? So we are facing this challenge, and based on this, the timeline may change, because usually most projects timeline change. I'm yet to see a big project that the timeline did not change by 2 weeks, by 1 month, by 3 months, right? Your job as a change manager is to ensure that you are communicating clearly, effectively, and even ensuring that you bring those facts. Sometimes once you just identify it, that the way I'm seeing these patients that are meant to be using these headsets, for example, they're not even showing up. Let me start to tell the sponsor or the key stakeholders you need to report to that we may be having an issue. Just be proactive, right? We may be having an issue that we're expecting these people to come in the next 3 days, or we're expecting them to come within this week. Nobody has showed up. So we are moving this testing of the headsets to next week. Usually they don't have a problem with it, right? Unless it's going to affect the budget, and this is where you can help them make decisions to halt the project for now, especially if it's something you cannot control. So these are realistic things that happen based on my experience. Please, how viable is the Rome Business School? Which one is Rome Business School or Ude? I'm asking because I want to run my master's degree in project management. I don't know the Rome Business School, but go for it. Go for your master's in project management if it's not expensive. Also look for a place where you can volunteer to run projects for free. That is the place that you get experience. I'm telling you, certifications, I'm not really very focused on certification. I'm really focused always on experience. So while you are doing your master's in project management, please look for, and that's how I started as a project manager. I started to volunteer a lot for people because I wanted to gain experience. Yeah, you can also do PMP, you can do Prince 2 if you're in the UK. Prince 2 is equivalent to PMP, yeah. For masters, I mean, maybe he wants to start with masters before moving on to PMP, because you can do masters, you can do PMP. PMP is for professionals, right? People who have already started projects as well. So maybe he wants to have a background in project management before, because PMP, once you start, when you want to start the exam, they'll start to ask you how many projects you've done in how many months and all of that. So they expect that you've got the experience already, and you just want to improve your certification, increase your certification portfolio. Okay.
Let me just chime in on this project management education thing, because I know I did PMP and I know Prince 2 is also pretty good. It just depends on where you are and you do your homework and know what's relevant there. Because in some countries, you come with a PMP, you don't know what it is. They will ask you for Prince 2. And some places you come with a Prince 2, they will ask you for PMP. And some places you come with a project management masters. No one looks at that. It's like, what's that? Everybody, we know project management is something you do even as you're doing your healthcare thing. And so if you decide to still do a master's in project management, look for schools that have internship or co-ops alongside the program, because if you're doing a project management and it's just all course-based, something is wrong. So look for schools that have that. And I don't know which country you're in. You can tell us which country you're in. You can give them more insight as to, okay, these are some of the programs. And then there are also some, you're in Nigeria. I know Lagos Business School has really good programs. If unless you want to just leave the country, I mean, I understand. But Lagos Business School has really good programs and it's a great place to network. If it's 40 million, try converting that to, if you want to jackpot, how much you're going to spend in visas and all that. So I know it's a lot of money, but if you want, the school is pretty good and the curriculum is great. I know people who have gone to Lagos Business School, and if you want to network, if you want to stay back in Nigeria, it's a great place to go. But if you want to leave, maybe leave for a different course, not project management, because project management is also embedded in a lot of courses that you're going to do. So as a standalone course, I don't know if that's great value for money, unless you're going for a scholarship, and I don't know many schools that will give you a scholarship for project management. So do your due diligence in terms of business. You can do an MBA instead of project management. So I'm just thinking, you know, outside the box. So just do your due diligence. But I don't know how viable an MBA is. That's the thing now. People are looking for hands-on skills. It's now a skill-based culture more than what certification and what education you have. It's good you have the education, but what can you do? What projects have you done? What can you show that you have to tell us that to back this paper that you have is different from the culture we have in Africa of certification and paper, but down this side, it's all skill-based. So do your due diligence, know what you're getting into before you invest all that money trying to get in there. So that's just my 2 bits. So any other questions around what? I think we've had a very insightful session. I love the classwork and the vibe was great. Everybody contributed. Thanks so much, Victoria. And so guys, thank you for the time. And I believe, for this has been a wonderful session. And please, you can always follow her on LinkedIn, her socials. Please, if you have other social media platforms you want us to follow you on, you can put it in the chat. And if you want to post about the session, because I know it's been quite an insightful one for me as well. And so you can post about it, tag her, tag the DHSA, and that would be nice to also hear your feedback so that she can, all this thing is thought leadership. ProSci, do you know about ProSci?
ProSci?
Yeah.
No?
Okay, ProSci is the change management certification. It's like ADCA. ADCA is another, okay, it's a change management certification. It's expensive, it's like $3,000. And what they do is that they do like 3 days intensive training, and then they give you one exam to pass. But the training is really intensive. It's sponsored by organizations. Individuals go for it as well, but they do like in compulsory 3 days training. You bring out 3 days, and then you go do the training, and ProSci trains you, and they down administer the exam, and you pass it and become a certified ProSci change manager. I'm actually thinking of doing it, may or may not, because it's great, it's bragging rights, but it's still the same thing of what have you done? Because most of us, in terms of those who want to do PMP, if PMP requires that you've done some project management, and I believe a lot of us here, if you're at this level, we are not all beginners. You saw the portfolio of people on this call. They are not people who are just leaving school. So it's people who are already bit advanced. So you can tell that these are people who are probably managed projects, but it's just for you to understand what project management is, that you've handled a project, that you've led something, that you've organized something, no matter how small, be able to recognize that that's a project. And that's the thing about change management that we just learned about today, that it's not that you have to wait for something huge. You can start small. So it's the project you're managing doesn't have to be something really big, that I manage this $20 billion project. It could even be something that doesn't even require funds. You manage the project, you organize the training, that's a project. So you organize the webinar, you organize an outreach, that's a project that you did. And so you can actually count that as points for you. They do count that as points for people. So just have that in mind if you're planning for PMP. And if anybody, I have someone who coaches PMP, and she does projects alongside, like she has a wholesome package for PMP. Can let me know, and I'll recommend you to her. So thank you everybody for if you are on our group, I know some people here, this is your first time joining us. If you're on the group, we'll share the recordings the usual way, and you get it by tomorrow the usual way. I don't know if Rukevwe is open to us sharing this on our YouTube channel.
Yeah, it's fine.
Okay, that's fine. Okay, so maybe we can share just this session on our YouTube channel as well. So for those asking, would they live leaving us? You can get it on our YouTube channel. So try follow us, DHS Africa, on our YouTube channel for the session. Yeah, Melissa, you have a question?
Yeah, it's to Dr. Rukevwe.
Okay.
I wanted to ask, change management, the role, I think it fits more of like a consultancy role or contract role than a tenure role. What do you think?
Yes. Yes, it does. However, when you find yourself in a tenure role, you could be a change manager as well. Most of the time, changes are projects. So a change manager is a project manager most of the time. They try to deceive us that you're just a project manager. But when you look at the project, the scope of the project, you understand that you are just doing change management. So it's best money-wise to be in a consultancy role, but you could find yourself doing it even if you're in the regular tenure role.
Okay. So we're
All right.
almost at the hour. Do you have another question, Melissa?
Oh, no, thank you.
Okay. All right. Any other question? None? Clarification. So thank you once again. Please, guys, reach out to, I want to see the messages. I love the way you guys encourage speakers on social media. Please, I want to see the things you learned from today, the observations, the things you learned. I want to see that I would love to see that on social media, tag her, and so that she can also see that she made an impact today. that would be very much appreciated as a token, say thank you, as a way to say thank you to her. So thank you everybody for the time, and we'll continue our conversation in the chat.
Thank you all. Have a good day. Bye.
Thank you.
Thank you.